This is our case titled Sacroiliac Instability, question mark. Sacral spring test injury in a medical student, and she sustained an injury in April of 2013 during a musculoskeletal class in which they were treating a sacral torsion. And I'm Jerry Hesch with the Hesch Institute in Henderson, Nevada, very close to Las Vegas. Our website is www.hes, like Sam, institute.com. And so we finished treating this client on day one. We've been with her for 2.5 hours. And her pelvis now is much more symmetrical, but it's not really position and appearance that we're concerned about. We're much more concerned about how it moves. And so I'm going to demonstrate a superior glide spring on the left. You can see the movement goes through that rather readily. And a spring test on the right. Okay? And take up the slack on this side and spring inferiorly, and I can see it bounce right back. And I can take up the slack here, spring it, and I can see the heel bounce back. So the force is translating through her body. That's the key concept. Can we have you get up in child pose? Your comments?
It's easier to get up.
Yeah. Last time you couldn't do that. You had to lie on your side twice.
Yeah.
So there is better mobility throughout your structure. That's what I wanted to see if that was going to happen. And I don't see, the sacrum is symmetrical in this position. Let's have you lie on your back, please. I'm going to place this in the. Okay. All right. So I can take up the slack, I can spring it, and there's some recoil, which was absent before. Can you feel that?
Mm-hmm.
Okay.
Do you think it'll gain more recoil?
Yeah, I think it will. I think that you're a very good candidate for an SI belt. It's not exactly the same as the left side, but it is much improved. The recoil is improved. If you
you think it'll ever be even again, like even recoil on both sides? Or
I
do
do.
you think,
I do. You know why?
Yeah.
Because it's not off by a whole bunch.
Okay.
It improved just with us doing, what did we do, 7 different things with you?
Yeah.
We restored hip extension, which then restored hip rotation, and that restored spring here. It restored lift on the patella. You lacked hip extension. Can we show the gain in hip extension? Would you lie on your stomach, please? So she's much more, I'm going to say cooperative, but she lets me impart movement through her body now, and that's 15 degrees. That was completely absent. We already showed the spring test with you prone. So let's have you step down and walk around, okay?
Okay.
So this is the first time that we have her get up off the treatment table. And I see her walking faster than she did before. A lot less compensation, a lot less circumduction on the right. Pelvis is not shifted over to the right as much. You do see a little bit more reluctance on that right side. We're starting to get her out of the woods is what I'm saying, but we're not quite there yet. I think you can see that readily. But I see a big improvement. Your thoughts?
It feels better than before.
How does it feel better? What's different?
I don't feel like shriveled up and tight. It feels like I can just, extend my leg better. Before it felt like I was teeter-tottering when I was walking, but now it just feels like it's more even.
Okay.
That's the way I describe it.
Okay. Certainly want to do some work with your upper body also, but I'd really like to get a little more freedom in that hip and pelvis. But we've certainly done a lot for one day. I'm a little exhausted. I'm almost, stumbling over my words. And it's 4:30 on a Saturday. And so, I just would like to see a little more freedom of mobility through that right hip and pelvis. Not quite sure what's limiting it, but we will investigate more tomorrow. But let's have you step on the scale again and see how your weight bearing is. So just stand. Some reduction. It seems to be staying below 25. And before it was bouncing up a little bit above 30, wasn't it? Mm-hmm. So there's some improvement, but there's also a lot of room for improvement. So can you wrap things up for us? Just go ahead and step down and just kind of tell us, how do you feel? Is there a change in your pain? What are your thoughts?
It's less painful, and I feel like it's less tight. So it's a big improvement from where I was before. But like you said, it could be better, a little better, but better than when I walked in, for sure.
What's your emotional state?
More hopeful than I was when I walked in. Before there was no hope. Now I think I may have a chance at getting my life back and going back to school.
I feel very optimistic. Was very anxious myself. I hope I didn't show it. I hope you didn't pick up on it, but when I see someone walking the way you walked in the door and laying on the sofa while I do an intake history, that's very disconcerting,
Yeah.
So, but at the end right here, I feel a lot more optimistic. And it would be interesting to put an SI belt on you right now and see if that changes things yet further. But I don't want to. I want to see what your body does. Tomorrow we'll put an SI belt on you.
Okay.
So we have a lot of detective work to do tomorrow.
Okay.
So we'll stop filming now. Thank you.